So, this topic is about the bone health and osteoporosis. Basically, how we can define the bones. It is the living, growing tissues provide the structure and support and protect the vital organs. So, what are the functions of the bone? First, it's support. For example, they give support to a body by forming the body's framework. Second, it help in the movement. For example, it serve as attachment site for muscles through tendons, which help in the movement. Third, protections in hard bone shield vital internal organs like the skull and ribs help in protection of delicate organs. And mineral storage, bones store the essential minerals, especially calcium and the phosphorus. What is the bone health? Basically, the bone health can be defined as the strength and density of the bones which change throughout the life. It may be affected by the lifestyle and the nutrition. So, the bone growth stages, for example, in the childhood, rapid growth, teenage years, peak bones buildings, and in the adulthood, maintenance is the growth stages. So, peak bone masses, for example, the maximum bone strength achieved usually reach in early adulthood, important for future bone health. What is osteoporosis? Basically, the bone disease causes weakness, bone become thin and the fragile, and the higher risk of fractures. So, who can get osteoporosis? For example, older adult people with poor nutrition, those with low physical activity. So, causes of the osteoporosis, for example, low calcium intake, vitamin D deficiency, lack of exercise, and hormonal changes is the cause of the osteoporosis. So, what are the signs and effects of the osteoporosis? For example, weak bones, fracture, loss of height with over time. Why osteoporosis is serious? Because the fractures heal slowly, it reduces the mobility and it affects the quality of the life. Now we define the role of the calcium. Basically, it is the main minerals in the bone, which is need for the growth and the repair of the bone and must be consumed daily. So, what are the sources of calcium? The main source is the milk, cheese, yogurt, leafy green vegetables, and fortified food. Now, what are the role of the vitamin D? It basically help absorb the calcium, support the bone strength, and prevent the bone loss. What are the sources of vitamin D? The sunlight exposures, the fortified milk and cereals, and the egg and fish are the source of vitamin D. Now, what is the exercise and the bone health? Strengthen the bones, improve the balance, and reduce the fracture risk and help for exercise and the bone health. Best exercise for the bone, like the walking and the running, the jumping sports, and the strength training, is the best exercise for the bones. Now, what is the lifestyle habits for strong bone? Like the balanced diet, the regular exercise, and the adequate sleep is the lifestyle habit for the strong bones. Now, the question is how we prevent the osteoporosis by building the strong bones early, maintain the healthy habits, and regular health checkups. So, as a concluding marks, bone health is lifelong prevention. Start young, strong bones lead to a healthy future. Thank you so much.